Gonna make sure we're recording. We are fantastic. So, welcome, welcome, welcome. This is a presentation where we're talking about the launch of our Richer Health Hotel and Wellness Center. This is a partnership gathering meeting. So, this is our first time that we've been going public with this. We've been really quiet, heads down, super focused on crunching numbers for months and months, putting together a pitch deck. We've been acquiring land. We've been building relationships slowly within a community and abroad. And this is based on 20 years of my life's work, all now culminating in this project. So I'm very, very excited about this. So thank you all for being here. We are recording this, so you're going to get a recording afterwards. So feel free to just listen. You can take notes, but we're taking notes for you as well. So yes, just please sit back and receive. Okay. So thank you for being here. I cannot stress that enough because this is a huge project, the biggest project I've ever worked on in my entire life, that our company and our team have ever worked on. And it is a big, hairy, audacious goal that I had set out for when I first started learning about chronic disease reversal nearly 20 years ago. I was in California, and when I found the recipe, the way to reverse chronic diseases, I knew that this was the way to better our environment, better our healthcare system. I immediately started teaching this, and my clients started reversing chronic diseases fast, like faster than I've ever seen it done. I didn't even know chronic diseases were reversible then. And so I had this vision that we would have these healing center hotels slash wellness centers slash new age hospitals all over in every province in every state in North America so that people didn't have to travel far to be able to get the healthcare that they needed. So I would like for you to also think about turning off your phones. Often in our day and age, we're multitasking and we're distracted. We have messages coming up on our screen. So if you would like to close down all the apps that are running and just be fully focused on this, this is an exciting opportunity. I invite you to turn off your phones and minimize distractions. Children are welcome always, though. They are not a distraction. So invite them to come and sit with you if they're floating around. And like I said, this is being recorded. Now, I would like to do a land acknowledgement, and land acknowledgements for me are very, it's more than just words. It's all about honoring the land that we are on, the people who lived on these lands for millions of years before we ever got here as colonizers collectively. We are all colonizers on this land for the most part. And for me, it's about more than just doing a land acknowledgement, but recognizing how everything that we do, everything that you do, the air you breathe, the soil that you grow your food in, or that the farmers grow their food in, that make its way, that food that makes its way to your lips, the water, the clean water that you drink, if you have access to clean water, because not all communities across Canada have access to clean water, the furried friends, the feathered friends, the winged friends, the finned friends that are all around us, that for generations and generations, Indigenous peoples all over the world kept these lands sustainable, healthy, in a vibrant, balanced ecosystem. And through our actions over the last 500 years, we have raped and pillaged the land, the soil, the air, the water, and we have decimated these lands as well as decimating the lives of millions of Indigenous people all around us. And the devastation that's been created for that has led to intergenerational trauma that is present everywhere, not just amongst Indigenous peoples, but amongst each and every one of us. And so when we are doing a land acknowledgement, it's to acknowledge the gifts that have been handed down through the generations via sustainable living, but also to honor and acknowledge and recognize the harm that's been done simultaneously. So I am so fortunate to be able to live, work, and play here on Vancouver Island in Duncan, British Columbia, sitting in the Cowichan Valley and living, working, and playing amongst the Indigenous Cowichan peoples. It's a community made up of multiple tribes, and I'm just every day give thanks that this land is here and work every day to make sure that the work I do is going to contribute to the next 7 generations. And so I like to hold space for that. And as you're sitting there where you are in with your bums in your seats and the chairs, just to acknowledge the lands that you are on as well. So thank you. Now, we are going to be working through an agenda that looks at the crisis that we are currently sitting in right now. You, me, everyone around us, if you are living in North America or any westernized, colonized country, you are all affected by these same statistics. And this was not the way it was 100 years ago or even 50 years ago. We are in the middle of a health care crisis right now. We also know what works. So I've been doing this work for 20 years, reversing chronic diseases and mental health disorders, and we know what works to the point where I could take 1,000 people with diabetes and reverse their diabetes in as little as 7 to 30 days. And we've proven it over and over and over again. This is not about fad programs, fad nutrition, fad diets. It is about doing the work that actually gets results diagnostically and changes people's lives for the better. We're going to be talking about the Richer Health Hotel, what that actually looks like. Why the heck is it a hotel? We're going to be talking about the Stay to Heal program and how that works. And Stay to Heal is a term that was created by Bee from A-Linker. She has an incredible company. There she is right there. Thank you, Bee. So we've adopted that name. And we love to use that for this hotel because it is a place where you will come to stay and heal. And when we say heal, it's not just about feel better, be rested. It's not just about, coining the term wellness. What does wellness even mean? But it's actually about you leaving diagnostically better with your lab results showing that you are better. And then because of that, what impact does that make in our greater community? And of course, there's a partnership invitation. So we would like to extend many different ways that you can partner with us. And we'll talk about that. And then we're going to leave lots of time for Q&A. Okay, so my name is Dr. Nicolette Richer. I am not a medical doctor. I am a researcher. I have a PhD or a doctorate looking at the barriers that exist to accessing clean, real, whole foods that nutrify our bodies, clean, real, whole, healthy water and air systems that nutrify our body and heal our body. So I particularly focused my research on BIPOC communities, so communities of people of color, Indigenous peoples, and looking at what prevented them from accessing good quality foods and water and air and everything that stood in the way. And so that was what my research focused on. The reason I focused on that is because that is what we need to be able to live chronic disease free. We need nutrients, we need clean air, clean water, clean soil. And without that, then our chronic disease rates just increase. So we are in the middle of a healthcare crisis. Chronic diseases and mental health disorders are rising faster than ever before. In the early 1940s, it was rare to see diabetes in Indigenous communities, and now more than 1 in 3 people are diagnosed with diabetes, not just in Indigenous communities and BIPOC communities, but in all communities across North America. Mental health disorders are expected to rise to be 1 in 2 by 2030. 1 in 2 people will have a mood disorder, depression, anxiety, PTSD, panic attack disorder, bipolar disorder. The list of mental health disorders are on the rise. So it's a problem. They're rising in every age group. We're now seeing multiple sclerosis in children as young as 3 years old, children that are in vitro that already have heart disease, as that's passed down from the parents, not genetically, but through lifestyle, through the foods that they eat. We're seeing autoimmune disorders on the rise, infertility on the rise. And these statistics are not getting better. They're getting exponentially worse every 5 years. our healthcare system is trying to keep up and it's doing the best that it can with the knowledge that it has. But medical doctors are not trained in chronic disease reversal. They're trained in how to diagnose and prescribe. That is their job. So they're doing the best, but they're limited in their resources. The individuals that suffer the highest rates of suicide are nurses and doctors. So the very people who are there to help us heal are the ones most affected by these mental health conditions, from the stress, from the trauma, from the lack of resources, from not being able to do the job that's required of them in healthcare, which they go into healthcare wanting to help people heal, and they're not able to do that because their hands are tied for many reasons. They're overwhelmed. Now in British Columbia alone, wait times in emergency rooms are anywhere from 4 hours, but that's really rare. So looking more like 8 hours to 13 hours in an emergency room. But 93% of the visits are for chronic diseases that are fully preventable and reversible. So what Richer Health has been doing for the last 20 years is keeping people out of emergency rooms, out of hospitals, out of doctors' offices by getting them off all their prescription drugs and having them live their lives free of the chronic diseases that they were previously diagnosed with. So we can take the pressure off the healthcare system. And families and communities, they are carrying the tremendous, tremendous emotional and financial burden of these chronic diseases, which are reversible. So longer wait times, limited access to treatments, high medication dependence now. 60% of Canadians and North Americans are living with at least one chronic degenerative disease, but many more are living with 2 to 3 to 4 chronic diseases. We are spending 93% of our total healthcare spending budget on reversible diseases, where we could be spending that $3.9 trillion, putting it into research for incurable diseases, rare diseases, genetic diseases, but we don't even have the money to spend on that because we're treating things that are so easy to reverse. And so that's where we come in. Most treatments just manage the symptoms, not the root causes. And I know this from the thousands of people, over 11,000 clients that I've helped, that they want more. They just need to know how to reverse the disease. And they go and they do the work and they do it. They want to feel well and they want their lives back. So that's what the hotel is all about. So there's a huge opportunity out there, and we know how to reverse these chronic diseases. Many people do not know that chronic diseases are reversible. I teach physicians all around the world. I teach healthcare workers all around the world. And when I tell them that diabetes is reversible, they're so shocked to hear that. Researchers at SFU, at UBC, at Kwantlen, I teach in universities. When I get called in to teach about chronic disease reversal, they're shocked. Their jaw hits the ground because they often say, we didn't know chronic diseases were reversible. We were only taught that they were incurable and that people, once they were on medications, have to stay on those medications for the rest of their lives. But that's not true. The only difference is in medical school, doctors receive 1 to 4 hours of nutrition training. That is it in their 8 to 12 years of medical school. So when people ask me, why doesn't my doctor know about this? Well, it would be like asking your plumber, why does your plumber not know how to do the electrical work in a house or a building? They just weren't trained in that. So after 2 decades of working with thousands of people around the world in 187 countries, we know that chronic diseases are reversible. It's so exciting when we take somebody who's been on 36 medications for 50 years, some of them. I work with clients in their 80s, and we get them off all of their medications for heart disease, high cholesterol, high blood pressure. We reverse infertility. We bring women out of menopause who thought they were in menopause, but that's not what happened. They went into early menopause because their systems were overloaded, and so their body just shut down their reproductive system. So we get them out of early menopause and they get pregnant and have beautiful, healthy babies after being told for 15 years that they would never get pregnant. We get people who were in wheelchairs, not able to walk, to reverse the neuropathy and walking again. So when people change what they eat, when they detoxify their body, this is the two premises of the therapy that we teach. They move, and we get them moving their body daily, even though they don't even need to move. We don't need to get them to exercise, actually. We can reverse their diseases through food and detoxification alone. Yes, we do address their trauma as well, but that we don't even have to do to be able to reverse their diseases. And when they're supported in a community that can support them in how to eat well and eat clean and live clean, their body heals. And really, it's the farmers that are helping them do that. It's the local produce managers that are supplying the organic, fresh grown foods. And we teach them how to prepare those meals and how to eat them in a sustainable way. That's when their body heals, and they heal fast. So we've seen people get off medications, get off disability. The most exciting thing for me is when somebody has been on disability for years, they get off disability and they return to work, they return to their sports, they return to their community. It's incredible having somebody reverse their arthritis that's been crippling, and then they go back to playing baseball again when they left the team years ago saying they'll never return to sports again. So that's exciting for us, and that's what the hotel is going to be doing. So we have proof of concept because we've been doing this for 20 years through our Eat Real to Heal programs and through our restaurants that we've had for 13 years. So I founded the Green Mustache Organic Cafe. It's plant-based, organic, whole foods. Everything is made from scratch. Nothing comes out of a bottle or a package. The local farmers grow the food when it's in season, pick it in the morning, deliver it to our restaurant. We prepare it and serve it to our customers. We've taught thousands of people in education programs through our restaurants how to use food as medicine to reverse their chronic diseases. And we also have had our programs running globally in countries all over the world, in Kung Bao, China, in Malaysia, in Laos, in so many countries all over the world, in Africa, in prisons in the United States. It's been so exciting. Taught in schools. We often get hired to go teach in schools. We often, through our charity, deliver free programs in different communities that aren't able to access our programs because of financial constraints. And we've been able to support communities all over the world. So I just want to share, this is the most common question I get asked when I do media interviews and when I'm on podcasts is, how did I learn about chronic disease reversal? So it started off with this man here on the left of your screen. This is Bill Nasby, a top realtor in North America for Remax. At 72, he was diagnosed with stage 4 cancer that had metastasized to his bones. He had always, for a long time, had type 2 diabetes, heart disease, high cholesterol that he was always managing. And when he got diagnosed with cancer, they told him he had 3 months to live. And they told him that there was nothing else conventionally that they could do through conventional medicine. So no surgery, no medications, no chemo, nothing. Told him to go home, get his affairs in order at 72 years old, and that was it. Well, this isn't a conventional man. Bill was breaking the boundaries in all areas of his life. So he learned about metabolic nutrition and detoxification. He learned about the therapy. He followed it to a T, reversed his metastasized stage 4 cancer, and he lived 22 more years working until the day that he died. France, a beautiful woman in Whistler who now lives on Vancouver Island, she had endometriosis that was plaguing her entire system. Surgery didn't work. Medications didn't work. It would just return every 6 months. They just would say, let's cut her open, scrape it out. You can go back to trying to be a mother. She was only able to crawl from her bedroom to the bathroom. That was it. She couldn't take care of her 2 little girls. She started our program when she found me. I was her next door neighbor, reversed her endometriosis. And that was, I don't even know how many years ago that was, 10 years ago. Did not return. She's thriving. She runs a beautiful farm now, homeschooled her kids, incredible human. She was able to return to being a thriving member of her community. And we've reversed thousands of more chronic diseases in thousands of clients, hundreds of chronic diseases in thousands of clients. And you can see all of these here. So the missing piece. There is no dedicated place in Canada right now where you can go to fully immerse in a protocol that reverses chronic disease quickly. Most of the centers where you can go, and there are other centers that exist around the world in Germany, Hungary, many of them exist in Mexico, and I'll explain why. There's some in Hawaii, Sedona, Arizona, Florida, and other parts of the United States. But the thing you must know is the reason why chronic disease reversal centers operate in Mexico, it's because if you are a practicing physician in Canada or the United States, you are not legally allowed to prescribe a nutrition protocol, a specific nutrition protocol to a patient without losing your license or being fined. Because nutrition is not considered evidence-based medicine, specific nutrition protocols are not considered evidence-based medicine within our Canadian and American medical system. So that's why physicians will open up clinics in Mexico so they can avoid losing their licenses in Canada and the United States. But when somebody has a chronic disease and they're in pain and they need to be available to go to doctor's appointments and see their doctors and see other healthcare practitioners, it's not easy for them to travel. So to get on a plane and go to Mexico, it's very, very hard for individuals that have advanced chronic diseases. So they need to be able to get in their car and drive to a location that's close to them, which is why we want to open the first hotel wellness center in British Columbia and then be able to open up 50 more locations in North America, Canada, and the United States so that people don't have to fly to Mexico to get their treatment. And to do these chronic disease reversal programs. So people do want support. We've seen that because we've had two other wellness centers. We had one for 4.5 years in Pemberton, and clients would come from Europe and across Canada and the United States and Mexico, and they would come to us in Pemberton and to come to our wellness center. The centers in the United States and Mexico have a wait list. But the thing is, the other reason why we want to open up this project is because we want it to be affordable. It is very expensive to go to these clinics, almost 6,000 US a week just to be able to go to these clinics in Mexico and Hawaii and Sedona. So people want support. They also want to be close to their community when they do this. So they want their families to be able to come with them, but it's expensive to do that in these other areas. And they want their families to come so their families can learn how to do this. It's considered lifestyle medicine, so they can receive the support and education and also engage in the eating as well. And then this way with the hotel, they'll be able to do that. And so that's why we're opening this up, and we're putting it all under one roof where all of this can happen. So introducing you to the Richer Health Hotel and Wellness Center, this is a different, what we're doing is different. This is considered medical tourism, which exists all over the world. So that part's not anything new. The only difference is, though, is that we are reversing the chronic disease. So when a client comes, we teach them everything they need to do. And if they stay for a week, we can, I'm not allowed to guarantee anything, but I've done this enough times now that I can guarantee that if you have diabetes, you will be using 50% less insulin within 24 hours of arriving at the hotel by eating our foods, drinking our beverages, doing our protocol. And chances are within 7 days of staying at the hotel, you'll be off all your insulin. And I know that because when I work with somebody with type 2 diabetes, we get them free of diabetes within 7 to 30 days with all their diagnostic test results within 3 months showing that they no longer have diabetes. All done through beautiful whole foods that they eat, beautiful beverages that they drink, the missing nutrients via supplements and detoxification. So we're blending hospitality via the hotel, science via our program, food as medicine, indigenous wisdom, because at the end of the day, all we're doing is teaching people how to decolonize their plates, get off the processed foods. And of course, we're going to have additional trauma support for individuals via approved psychedelic therapy programs in as part of the clinic as well. So the vision is a gorgeous hotel designed by an amazing architect who's here today on this call, Ty Farrow, who is a senior partner of Farrow Partners Architects. And Ty has been designing buildings and building buildings all around the world. He builds buildings that cause health. that give health back to the individual simply through the design of the building. I used to be in the green building space, and that was to make sure that we're using low, volatile organic compounds, that we are making sure that the products are sustainable, that the buildings are being built with. But Thai goes beyond all of that by building a building where the design of the building itself makes you heal, makes you feel better, makes you breathe better. He brings the outdoors inside, but also designs the buildings so that it feels like you're outside for the majority of time, where there's lots of light and clean air and so on. So we're going to be working with Ty Farrow on the building of this building. It is a 170 suite hotel, capable of sleeping more than 340 people each night. It will have an organic plant-based whole food restaurant that makes all of the food for all of the guests at the hotel, as well as the community can come in and access food. It also has beautiful healing spaces, so you can get all of the services that you need through massage and acupuncture and health coaches, etc., as well as education and training center within the hotel. We're going to be hosting conferences for physicians and healthcare workers to learn about what we do, and of course, working with our local Indigenous communities across Vancouver Island as well, as a true act of reconciliation as well. So we'll be training over 1,000 individuals in this therapy, creating over 233 jobs within the hotel directly. A little bit more about the architecture. You can read Ty's book, How the Built Environment Enhances Your Mind's Health. What the guests will experience, I've talked a little bit about that. So nutrient dense meals, all organic, so sourced locally from our organic farmers, restorative therapies, movement training classes, connection and community. And it's obviously not a typical hotel that just offers, steam room, sauna, a pool, massage. We go way beyond that. Our guests can come and they can book as many nights as they want. From a few nights, we encourage 3 nights minimum to learn the therapy, but they can learn the entire therapy within 3 days. But some clients, we've already been told from existing clients that they want to book out 2-week stays with their families twice a year so they can reset after they've healed. So that's been wonderful to hear that, and they're so excited to get this happening. And they will receive the ongoing care that they need through their food and their stay and detoxification and all of the additional classes that we provide. This is all based on clinical integration as well. So with all the work I've been doing, I get referred by physicians, and so they send their patients to us for psychedelic therapy as well as the chronic disease reversal therapies. It's all based on co-treatment as well. A lot of people think that if you use food as medicine to heal, you can't use any other therapies. That is not the case. We love conventional medicine, especially if you're in a car accident. Like, let's get, emergency team to heal you through all the things that they do in hospitals. But we do know that lifestyle medicine is what reverses chronic diseases. Multiple communication pathways through our clinic. So I always work with my clients' medical teams as well. It's not that you need to abandon conventional medicine at all. That's not how we work. We work together. We always have. And of course, our hotel will also be a research center. So we'll be doing a lot of research and collaboration with local universities, starting off with Vancouver Island University, which is only 5 minutes away. We've already been talking to them about a partnership, and we hope to have that solidified, as well as Kwantlen University, Simon Fraser University, UBC, and some of the smaller colleges as well. We want clinicians and healthcare practitioners to feel confident referring their patients, as they have all along, but building new relationships with the healthcare teams here on Vancouver Island. And again, we'll always be providing everything through diagnostic evidence, clear communication, as well as publishing case studies on the individuals that come and stay at our hotel and heal and reverse their chronic diseases. Indigenous and community partnerships are very important to us. And so it's not just about getting local art into the hotel, which is lovely and beautiful. And of course, we're going to do that, but that's at the very bare minimum. We've been working with Indigenous communities, specifically the Lilwatan Squamish nations, and we ran programs with them for their youth and their elders, teaching. And I don't like to say teaching, but helping them remember um, traditional food as medicine, because that is what we're ultimately doing with our clients. There'll be land-based learning, there'll be tours to the local farms, and all of this will be integrated into the tourism model that our hotel brings as well. And so we also want to look at uh, had this project being something different than when often businesses will build a business to sell it and be acquired by larger companies. We've already been approached and communicated with the Marriott. That was a path we were going down until our CFO, Tanya Lowe, she sits on the board of Salmon Returns, and she planted the seed in us that we can do better. And so we want to look at having the land where this center will be actually being owned by the community and by the local Indigenous bands as well. So those are partnerships that we'll be developing. Um, these are some of the social, there's many environmental benefits. I'm not even going to go into all of that. That's in the pitch deck. And if you'd like to see our pitch deck, please ask me for that. You can email me and we'll send that to you. But some of the social benefits that we are going to see through this hotel, number one, we're going to be serving 72,000 clients a year. That's only at 58% capacity, even though hotels in BC now are reaching 86% capacity. So we're very conservative in our estimates. But 72,000 people a year are going to be impacted by our hotel. When they reverse their chronic diseases, we know that that is 345,000 medications that get discontinued. And these are based on historical numbers, based on the percentages of people that we're able to get off their medications. We're going to be creating 230 local jobs in the community. We're going to be forming over 50 Indigenous and school partnerships as a result of this one project alone, and billions of dollars freed for families, insurers, and governments as we save our local healthcare system millions of dollars every single year, because the patients do not need to go to the doctors to manage their diabetes anymore, their heart disease, mental health disorders, and more. The economic benefits are huge, 173 million plus in annual healthcare costs saved. The average savings per patient in their lifetime is 169,000 per patient that gets saved when they reverse their chronic disease. And if we multiply that by the 72,000 individuals helped every year, you'll see that this is huge impact. And so 3.6 billion NPV healthcare savings in just the first year alone. And that what that refers to as well is, there's productivity costs. So when somebody's on disability and they're not working and they're not able to pay taxes as a result of not working, there's the economic potential that is lost, but there's also the social potential that is lost as well. So what we are building together is a national model for reversing chronic diseases at scale. People will come from across Canada, across North America, and other parts of the world to our center. We know that already. And so this is truly just a blueprint for locations across Canada and then eventually into the United States as well. Now, some of the partnership initiatives that we're launching, it's for obviously the clinicians on the island here, and as well as in Vancouver, because we know people will be coming over from Vancouver and physicians will be referring their clients to us. They already do. So there's the healthcare teams that can refer their patients. We're looking for those partnerships. Nonprofit organizations that are in the space of health and wellness, but don't yet know that chronic diseases are reversible. Indigenous community partnerships. In BIPOC communities across North America, they suffer from chronic diseases at 4 to 8 times higher rates than non-Indigenous and non-people of color communities. And it's not because of genetic reasons, so it's important that everybody understands that. It is because BIPOC members have been taken off their lands, put in reserves, put on lands that don't grow healthy food. They have lack of resources, lack of health care, lack of all of the things that are needed to be able to live healthy, thriving lives. And as a result, they suffer from higher rates of chronic disease. They also pay 18% more for their foods than we do. And in some communities, it can be up to 100% more for Indigenous communities to be able to access clean, real, whole foods. And in some communities, they only have access to fast food and to gas station food in certain Indigenous communities and BIPOC communities across North America. We're also looking for funders and philanthropists. So if you are someone that has access to funds that are sitting there and you're making the decision of to where to invest those funds, where to donate those funds, where to give those funds. Yes, you can put them into mutual funds. Yes, you can put them into invest in, Tesla and invest. I mean, I don't know if you want to do that, but you can invest in, Apple, invest in all these other products. But you can also invest in the hotel. The reason we chose a hotel model, it's because hotels across the board have their earnings are 35%. That is huge. Through our restaurants, we've been consistently hitting anywhere, through COVID years as well, but 2% to 15% profit. And this is huge. And so most restaurants in Canada only actually earn about 1 to 2% net income. So we've already proven that we are sometimes 5 times more profitable than that. However, hotels do much better than that. So we vetted our numbers through hotel groups that have been around for over 150 years. They looked at our numbers, they crunched their numbers, and they told us that we are very conservative. And they said, yes, we'll be able to hit those numbers. So, and we think we're going to do better because we have this wellness component attached on top of the hotel model, which most other hotels don't have this. And so our customers are going to be paying for those additional services at an affordable rate. And one thing I should mention is we also have a charity. So a lot of individuals will wonder how our services are going to be able to be accessed by individuals that don't have the funds to traditionally acquire our services. Well, I started a charity in 2016, and that was so that we can raise funds to be able to offset the cost for individuals who can't afford our services. So we are looking for investors. We are looking for funders. We are looking for donors, philanthropists. If you know any of them, we would love for you to connect us with them. If that can't be you, that's okay, but perhaps you can send an email or an invite and connect us, and we can have a meeting with one of those individuals so that they can put their money to good uses and to this hotel. So referrals are welcome. Research. If you're a researcher and you want to partner with us, please let us know. If you want to just provide a letter of support, that's significant. It's not just a letter of support. It is a letter of support, and that goes a long way. Any introductions as well and other partnership ideas you have, please let us know. So we need early champions. Now, this is where we're at. This is a $50 million project, and we also want to have a $20 million contingency fund, so really $70 million. We've already been told that a bank will fund the construction costs at 50%, so we need to raise the other 50% as a down payment. Those construction costs will get rolled into a 50 to 60-year mortgage, but it still means we're raising $35 million. But that's okay. People raise money all the time. We've raised millions before. We can do it again. There's just an extra zero thrown onto this one, so we know we will do it. But we do need early champions, early supporters, funding support, like I mentioned, through donations and investments, loans, letters of support. And this is a pivotal stage for us. So we do want partners who believe in this vision. So if we've ever helped you reverse your chronic disease, or chronic diseases can be reversed, please help us today, because every level of support moves us forward. So next steps is we are going to have a Q&A period after this, but we will reach out to you after today just to ask if you know of anybody that we should reach out to who could support us. We invite you to continue the conversation with us if you want to know more. I am happy to jump on a one-on-one call with you and just brainstorm ideas, answer all your questions. If you don't believe me, chronic diseases can be reversed. I will sit down with you and I will teach you the full biochemistry, chemistry, and biology of how it works, because I want you to know that what we're doing is real. And I want you to have the knowledge and science behind it. And then, of course, introductions, like I said. And if you require any additional materials, please reach out to us and then help us promote future events that we'll be hosting in communities all around BC. Okay, so this is where you can ask questions. So the best way I find for asking questions is if you go into the chat and you put a number 1 in there, then I see the 1, and that means you want to ask a question, then I can go in order. So if you would like to do that, that is beautiful. If you can't find the chat, which sometimes happens, that's okay. Just unmute your microphone and jump in. Okay, so we have the 2 ways of doing it. So I'd love to open up the stage to all of you. Thank you for listening, and I am here to answer any and all questions that you have, or if you just want to provide feedback, that's great too. Let me just bring up the chat here. Great. So Kyle, you're up first.
Yeah, thanks for the presentation. My name is Kyle Young, the Director of Planning for the City of Duncan. And yeah, when Greg first let us know about this proposal, I wasn't really too sure what it was. So the presentation was really helpful in explaining that, and I think I have a better understanding now for sure. I have two questions. The hotel, like you mentioned that you, from a financial perspective, you plan for 58% capacity, but as you've noted, in BC, hotels often do better than that. Um, are the hotel units exclusively available to people who are coming to access the services, or if there are rooms that are available, are they made sort of broadly available to people who might not be coming to access services?
Yeah, that's a really good question. And the reason I chose the hotel model is so that we had that security of being able to have the hotel rooms available to the public. So this allows us to grow into the business model as well, so that anybody from the public can access the restaurant, any of the services and education and training and conferences that are available at the hotel, and the nightly stays as well. So some people who come may just see it as a hotel. They don't even know that we offer chronic disease reversal programs. And then, of course, they're going to come, they're going to hear about it while they're there. And there's a high probability that they will come back to Duncan to stay at our hotel because it offers these services. And that's through the feedback of our previous wellness center as well, and our restaurants, where we started those 2 businesses, and we have people that now specifically travel to Whistler just to access those services and programs every single year, again and again and again, even once they're healed. So yes, the hotel is available to the public at large.
Okay, yeah, and that's great because I'll see if we can send you the study. But our economic development Cowichan recently did a hotel needs assessment for the Cowichan Valley, and we have virtually no sort of conventional tourist accommodation in Duncan or the Cowichan Valley. So that study determined, I think at minimum we need 180 spaces. So just from an economic point of view, definitely needed. There's a real gap in our community in tourist accommodation.
Amazing.
Um,
And we can maybe bump up the number from 171 to 180 units, but we'll get Ty to work on that.
sure. The second question was just around timelines and whether you sort of had, I know it's early, but did you have a sense of, I think I saw something in the materials that the sort of desired opening date would be 2030, but in terms of development design and sort of breaking ground, do you at least have like a general sense of what you're looking for?
Yes. So every day we're learning more what the timeline looks like. We've acquired the land through a vendor take back model, and that's with Greg Roberts, who's here on the call. He is a developer who's built multiple buildings before, and Greg and his partner have generously said we can have the land to build this project, and then of course we'll buy. He will buy the land from Greg and work out that deal on the side. So it's nice that we have land directly in Duncan to be able to do this. And so now that the land is there, we've been working with Ty Farrow, and we have about a 9-month turnaround where we'll have all the architectural plans ready for permitting. So depending on how fast you can turn things around, Kyle, we are hoping to break ground in the fall of 2026. And it looks like it's a 2.5 year to 3 year build. So we're hoping for January 2030 to open. And hopefully a little bit sooner. Everything depends on, how our project manager, how everything works with the trades and materials and everything like that. But we've been told that that's a pretty safe timeline.
Sure. Okay. Yeah, thanks for that, and thanks for answering those two questions. And just from I can say from a staff perspective, we're really excited about this. We think this is a great project and proposal, and yeah, we're obviously glad that you've chosen Duncan as your first location for your first hotel. So. And treatment center. And so anyway, yeah, just wanted to let you know that from a staff perspective, well, there's probably lots of once we actually have a development design to look at, we would have some feedback and comments, obviously, but we support the concept and the project at a high level at this point.
Amazing. Thanks, Kyle. I really appreciate you taking the time to be here as well. And it's really nice to finally meet you as well. So yeah, thank you. Everybody heard it here today. City of Duncan is raising the roof to this project. So this is exciting. Thank you, Kyle. Okay, let me go to the chat here and see about more questions. Yasmin, you are up next.
Thank you, Nicolette. Can you hear me okay?
Yes, yeah, I can.
Yeah. I am very excited for this project. I was hoping that it would open like in 2 years or 3 years, but I understand it takes time. I have two questions. The first one, I am in the United States, and I know previously you tried to raise some fund for the Green Mustache. Only people in British Columbia were able to participate. Is there a chance that any donation or investment can come from people living in the United States?
Yes, and we have multiple avenues from that. So thank you, Yasmin. You have been an amazing supporter of Eat Realty Heal and Richer Health. Um, and I appreciate you so much. So you can donate through our charity. The only difference is that you won't be able to get a tax receipt for the donation. So that's one way. Anybody can donate through seatoskythrivers.com. And I'll get Scott to put the link to Sea to Sky Thrivers. That's our charity. We discovered that there's a model where charities can own businesses. So through the money raised through the charity will actually be part owner of the hotel, which is very exciting. And so that keeps it in the family for generations to come because it'll be owned by a charity. Now, the second model is that you could do a private promissory note. So we did that through our last wellness center, where we raised $425,000 through private equity. And it was a promissory note, which we paid back in 3 years. So through our last wellness center model, we paid back $425,000 plus an additional $75,000 in 3 years. So we know this model works. So promissory note is, it's like any it has the same risk that you hope the business does well so that you can get the money back. But we've always been able to honor all of our debt that we've taken on and promissory notes. And so that would be another way that we can do that. And with that, we negotiate the what your return on that loan would be. So we typically it was usually between 6% and 10%, which generally is better than what most like mutual funds are doing. And then you get paid back your money after a certain time. So you can do the donation, you can do a private loan, you could also do a investment um, through you would get shares in this company and you would own those shares for your investment. And you can be anywhere in the world to do that. But the only difference with that is that you need to be an approved investor, and which means that there's certain conditions you have to meet for that. And unfortunately with that is you have to be earning a certain income and you have to be in a certain income bracket. Now, I don't love that model very much because really it just means that if you're really wealthy, you can invest and then you can get interest on that and dividends and earn your and get your paid out in the end. Whereas the community doesn't get to benefit if they don't meet that income bracket. So then there's another way we can do it, and this is through community bonds. And through community bonds, that means you can give $500. There's no minimum requirement as far as how much income you need to earn. And it's like, so you, through the community bond, it's like you're an investor in the business. You're going to get paid back in interest and then you'll get paid out. And it might be in a lump sum balloon payment or it could be done over years that you get paid back, but you get to earn interest and get paid back your money. So there's that model as well. And we are now in conversation with Thrive and Purple and Tapestry capital to set those bonds up.
See the chat for a link to community bonds.
Yes, and yeah, and you can look at Tapestry Capital to see learn more about community bonds. And so we're going to have multiple ways because we would love the community at the end of the day to be owners of this hotel. And so yes, there's going to be multiple models. But that other platform that we went with, it was within their individual restrictions that we couldn't have people in all provinces donate, and we couldn't have people outside of Canada be able to give money to the project.
All right. Well, thank you very much, Nicolette. My second question, I think that you answered it while you were giving me the detail.
Mm-hmm.
On the investment donation or other form of investment.
Mm-hmm.
So wishing you good luck. And I think this is amazing what you're doing.
Thank you, Yasmin. You're so wonderful. Thank you. Okay, I don't see any other ones. So either that means we answered all the questions or you haven't been able to find the chat, and that's okay too. So feel free to unmute yourself if you have any questions and you'd like to know more.
Hey, Nicolette, can you hear me okay?
Yeah, hi, Greg. So Greg is the beautiful human who said yes to us building this hotel on his land. So I just want to say thank you, Greg, for being here, for all your support, so for believing in this project.
Thanks, Nicolette. Yeah, no, it's exciting to see you do the presentation and bring everyone into this project. I really have a great feeling about it. A quick question regarding I'm thinking growing roots into the community. Seeing as we got a new hospital being built and VIU, the Vancouver Island University, being so close, I'm thinking more preventatively. You and I have had long discussions. Looking at the future generations, you can see a lot of research where they're speaking how the generations now, their life expectancy is actually, through the research, predicted to be less than their parents. Mm-hmm. For all the reasons why you're speaking about. I'm just wondering, with the business model here, if you're if you're, I guess, looking at a preventative educational model where we can draw in even high school students, the VIU students, and programming to draw people from hospitals, to try and transition them out of the medical system into, I guess, what would you call it, self empowerment. that you're
Yeah.
offering?
Yeah, so yeah, that's a really great question. And we just had a meeting at Vancouver Island University. Universities are going through massive, massive overhauls and restructuring right now as a result of the recent government announcements. And so the conversations that we're having are, it's actually exciting because what Vancouver Island University said is that we can offer potentially continuing education credits to university students, healthcare practitioners, different peoples with different licenses, and that is a model where we can partner with them on potentially. We're going to be predominantly like the hotel, even though it's going to be offering nightly stays in these education programs as well. We're going to be hosting conferences. So currently, most of the conferences in this space, which is considered lifestyle medicine, they're held in the United States. And at these conferences, they get over 1,000 physicians that attend and healthcare workers and nurses that attend these conferences. Whereas in Canada, we don't have anything like this yet. So we're going to be hosting conferences in Canada. We're going to be training 1,000 individuals in chronic disease reversal, so chronic disease reversal specialists. So the hotel will be used as a center for that training. I just did a presentation at QMS. Their biochemistry AP department hired me or brought me in to teach their students, and we're able to do that at no cost to them through our charity. And so I went in there and taught their future medical doctors. So they're all the students that are going to go into medicine. And so they brought me in to teach Eat Real to Heal and talk about lifestyle medicine. So yes, it's a huge part of what we're doing is just educating people. These individuals will be able to come into our commercial kitchen that we're going to have beside the restaurant kitchen where the cooking classes will take place, trips to the local farmers. So we really want to show this systemic model for preventing disease, which is the same model for reversing disease. So that's going to be a huge part of what we do. So that's the additional part of the tourism is to provide that education. So we know people are going to be coming in from everywhere to learn that. So yeah, really good question. Thanks, Greg.
Thank you.
B.
Nicolette, thank you so much. This is so exciting. And of course, we've been on this journey for a while together and
Yeah.
have had many conversations about health and wellness and stuff. I've got two questions. One is, yes, by the time it opens, it's 2030. How can people, partners, whatever, support you and all the ongoing things that are happening right now to further support all the activities that will happen once the actual facility is there? I'm thinking about people that have spaces that can be used instead of you renting them, that can be used to partner with you or to make space and maybe a professional kitchen available for events so you become more visible, so you can get more support as you are building the actual facility. So that's just an invite extended to everybody on the call here. Like, it's not just a building, then yes, that's great, obviously. But what's happening alongside that you can expand all your services and training and maybe school presentations or whatever in the time that you're building it, sort of honing that whole community around it. And then by the time it's ready, it's all done. It's already all going. So
Thank
that's
you.
so that's one thing. The second thing is being myself in an industry where we do something that reverses a lot of medical costs, and you think you're doing the right thing, but it's actually against the whole industry and how the medical world makes money, or needs sick people to make money, so to speak. How do you navigate the whole mindset? Because I mean, and we've had conversations about that. I just want to put that in the realm here. You're doing something that is not the business model of the sick care system. So how do you navigate? How do you get partners on board to understand that this actually is good for everybody, even though that's not the business model? We've proven with the Alinker that once people start using the Alinker, they can save thousands of dollars per year, every year, on medical expenses they no longer have. Nobody's interested. So
Yeah.
how do you address the whole mindset around being such a disruptive idea? It seems so logical
Yeah.
once we're here, but it's actually very disruptive because that's not how the business models in the medical world work. How do you navigate that?
Well, I think post-COVID, it's a really beautiful time to be building this hotel because what we saw with all the comorbidities, so individuals that had diabetes and heart disease and high cholesterol and autoimmune disorders, so already their inflammatory markers are high. And if they got COVID, they had the highest death rates. So then everybody started, looking at ways to reverse inflammation and gut health and all of that. So it's so much, it was like an explosion of knowledge and wisdom that was being actually practiced out, people moving to small and creating small farms again. Like it's just huge, massive transformation as a result of COVID. And so, but what leading up to COVID, like what a lot of you may not know, is that I was hired by the Center for Chronic Disease Control and the Ministry of Health in China to go there to teach this therapy that I teach to 600 physicians in China, where they had then opened up a 150-bed wellness center there that's free to the people in China to go and stay there and to do this actual therapy. It includes 200 acres of organic farm to grow the food for the center. It's like an incredible project, and I have to do an event on a specific event just to show you what's happened as a result. And the reason they did that is because as China's been trying to keep up with the Western ways, that included more fast food, more processed food, and their diabetes numbers went from almost non-existent to soaring, to crushing the economy. And the reason why we were brought over is because they realized that their medical system was going to collapse just from diabetes alone, trying to treat and manage diabetes. So they're like, we need to prevent this and we need to reverse it. And so then that's why I was brought in. So one thing I've noticed and I've learned from having our businesses for the last 20 years in the Sea to Sky corridor, which is this contained area, is that the patients of the doctors would then come to me and they would reverse their disease, go back to the doctors, and the doctors are like, what? How did you reverse your disease? Well, I ate at the Green Mustache and I worked with Nicolette and the Richer Health team. So then the doctors started referring their patients to us. So it's slightly a grassroots movement, as it is also a top-down movement as well. So of course, as I was doing that work, then I was invited by universities to teach this, and then I was invited by government agencies to teach this. And so it's that sandwich effect that's happening. So grassroots, top down as well. So bottom up, top down, and then really hoping to just like meet in the middle. And it's just everything's about reaching a tipping point. When we have enough people that know about this, because even I was just talking with TD Bank, and I said, do you think that this is a project that you can get behind? And they were like, you can reverse chronic disease. And I was like, yeah, chronic diseases are reversible. And then I had to slow down the whole meeting and stop talking about financing just to teach the bank representative, who administers millions of dollars to companies, and just to teach him about reversing chronic disease. And then, of course, he started asking me about his family members. And then the whole meeting was about him and his family and like, can you help them reverse chronic diseases? And of course, the answer is yes. So your question is amazing. And it is true. It happened. I think the answer is that it happens through the proof is in the pudding, the plant-based whole food pudding, and it is through building relationships, right? Slowly. It's through having people that are healed that tell their story, and we publish their case studies, and more people learn about that. And I'm not the only one that's doing this. This is considered lifestyle medicine. Medical doctors get trained in this. After they graduate from med school, they can go and take continuing education credits in this. So there are more and more people doing this, but there's just not enough places for people to go. So with our last wellness center, we saw that people came from all over the world. Once they knew that it was open, the same thing's going to happen. So between now and then, yes, if you'd like to hire me to come in to teach in your business, place of work, your charity, your school, I am available to come do that so that we can just continue to have conversations like this, and people can learn about it, do it, and then see that it works.
Well, that's why I asked the question, because all the people on the call here are probably believers. So they're at a certain level of understanding what this is.
Yeah.
But the general world out there needs a lot more honing and explanation and proof and exposure to it.
Yeah.
And so, again, to all the people on the call, take that as something to have conversations with people about, to make sure that mindset slowly changes, because we need
Exactly.
to change the mindset from trying to get more nurses and beds in hospitals
Mhm.
to a place where we get less people in the hospitals.
Yeah,
That whole mindset needs to shift. And once
exactly.
this system is suffering enough, people are more susceptible, like, oh, how do we prevent people and actually ending up in that system that don't need to go to that, shouldn't be
No,
in that system,
exactly.
that whole thing. So that's
And
on a
I love
systemic
what
level, right?
exactly. And I love what you're saying because it reminds me of a customer that came into the Green Mustache. He was a realtor with heart disease, high cholesterol. The doctors had said you're going to get have a stroke or a heart attack any day now. Like you better change it. But he didn't know what to do. So the doctor wrote on a prescription pad, eat at the Green Mustache, our plant-based whole food organic restaurant. Eat at
Wow.
the Green Mustache every day, every meal for 3 weeks. And he did. It was on a
Mhm.
prescription pad.
Mhm.
And guess what? All his numbers returned to normal. He lost this weight that was, chronic disease is often, triggers a lot of weight gain as well. He lost all this weight, which he hadn't been able to do in 20 years, reverse these conditions. And now he's thriving and healthy and exercises and going strong and no longer at risk of heart disease or a stroke. So, yeah, it's in exactly what you said. It's that tipping point. It's like it's a shift of a system, shift of a mindset. And what I love is when the doctors that we train and the nurses that we train and dietitians, naturopaths, when they end up then taking the knowledge we've given them and they start teaching it to their patients. Like I can't teach everybody, right? But then they go and get certified in lifestyle medicine or get certified in our program, and then they set up their practices where they now help their patients do this. I mean, that's my biggest dream. And then they have purpose, and then they no longer want to take their own lives, which is amazing. I'm just thank you, B, for that. I'm Carolyn, so the cost of art to stay at our hotel is the same average as all hotels across BC. So we're not a high end, like even though our building's going to be beautiful and high end, we will not be charging Fairmont, $800 a night stays. So most of our stays are conducive to the Cowichan Valley, so like 250 a night to 400 a night, depending on what's happening. And then to add on the additional packages, it actually doesn't cost very much. I'd have to go back to our budget. I haven't looked at it in a couple weeks here, but it's just an additional surcharge per night to cover all your meals, your supplements, everything, and really just the same as if you went and ate out at a restaurant. So it won't be that much extra to stay per night. I think it's less than $100 extra per night. Now, to go to lots of wellness resorts that are out there, one of our investors, when they invested in our business, they couldn't believe it. They're like, how come it's so cheap to work with you? And I was like, because we have to make this affordable and accessible for people. And they had just come back from a wellness resort where they each paid $17,000 for the week, US, for the week to stay there. And they were allowed to eat 6 almonds a day and drink all the filtered water that they want. But they weren't getting like three full meals, their snacks, their beverages, their cold pressed juices, their supplements, their liver detox kit. Like they weren't getting any of that plus the education training. So it's really affordable to stay there. And then for the individuals that cannot afford a night in a hotel, like I said, we have the charity where we're raising money through foundations, and then we can offset their costs to stay at the hotel through our charity. Saskatoon, so nice to see you. I see that you have a new little one. Congratulations. Saskatoon graduated from our nutrition and detox coaches training program. She's an incredible human being. She published a book, which was that she did as part of our training, which was amazing. I'm so happy to have you here, Saskatoon. Um, yes, and if you can reach out to, the local band and let them know what we're doing, and um, you know, we're happy to partner in any and all ways, of course. Um, okay. I'm just looking at the time. If anybody, sorry, I know we're a little bit longer than we said. I think we said it was going to be an hour and a half. So if you do need to go, this is still being recorded. But if anybody has any more questions, I'm happy to stay here and keep answering questions.
Nicolette, if I can ask one more question, I think it might kind of draw Kyle and Ty into it. I was just curious what you thought the requirements would be for your convention component of the building. And I know going back and forth with the city and maybe Ty with his experience, Is that something you envision like on the top floor, on the main floor? Um, might be a just more of a building question kind of thing that I think Kyle and Ty and yourself, can maybe enlighten us on.
Certainly, the top floor has the potential to be an extraordinary portion of the building. And so the idea of what's the best group to use that space, not only the top floor on the inside, but
The roof.
the top floor on the roof. And in fact, we've also had discussions or initial discussions. Could in fact you hike up the entire building from ground all the way to the upper floor as a hiking, as a mountain, effectively, as the building, meaning that the building can be something that acts as a non-invasive therapeutic treatment along with the extraordinary things that are happening within.
Thanks, Ty. That sounds exciting. Um,
Well, and I'll
uh,
just add that I love this space where this land is because from the top floor, it has 360-degree views all around of the gorgeous Cowichan Valley. And it is stunning. You know, we have the ocean that's not far away. We have the mountains. We have like rolling farmland. It's really, really beautiful. So I think it's going to be like with Ty's incredible design sense and in what he's able to come up with. I mean, it's not the building itself will be a marvel where people will come to Duncan just to see this building. Like that is one of the reasons why 13 years ago when I met Ty, I was like, we are going to work together to bring health to communities, him through architecture, me through food as medicine. But I can see this building, it's going to draw people in just because of the design.
yeah, I find it exciting because we got the brand new hospital, and really, I think the VIU, a growing component to the
Mm,
community. It's so much bigger than what we're just talking about right now,
yeah.
helping each individual group, to bring in the educational component. It's just such a wide reaching, model. It's a human endeavor for today's modern problems. I mean, our biggest problem really is probably the phones that we carry, and lead to such sedentary lifestyles as well. People just want the convenience of easy food. um
Yeah.
you know so
Yeah, and you actually reminded me, we just met with a finance group who said that they bring their employees together once a year for a group meeting because everybody's working remotely. But the struggle that they've been having for years is to find a place where they can stay that serves healthy food and also is just has healthy programming there. And so already they're like, can we book our convention there? And so already now 3 years before, it's not even built, but I have a feeling it's going to move in that direction where I know that they're probably going to want to bring their employees back because often I get hired to travel across North America to teach other companies about this. And so to have people to be able to come in and then they can be, we can do all the teaching out of the center and through these conventions for companies is going to be incredible. For example, I was a Lululemon ambassador for 2 years. Recently, they sponsored our programs as the Real to Heal program. And then they, routinely hire me to teach their international team. So they'll fly their whole international team in, but, they book out the Westin and they book out the Fairmont and Whistler and they bring me in there and they stay for 4 or 5 days at a time. And so now they, I know I can attract all our sponsors and our previous partners to this hotel where they are going to be coming to learn about this. And so, yeah, it's going to be, and the universities themselves, they're often running trainings and programs. So they're going to be a conduit and we can house them here in Duncan at the hotel and work in collaboration with them. So yeah, forming those partnerships is first and foremost one of our number one tasks.
Nicolette, I was gonna just mention too. I don't think we've spoken about it, but when I first got out of school, I was working at a corporate medical clinic, and a large part of it was corporations actually had their executives coming in annually at the clinic I was working at for annual medicals.
Mm,
uh, and that was actually in their contracts with the corporation. So we had a steady stream of all the business elites in Vancouver, just coming through annually. I mean, you could look at a similar program, with the larger, the BC Hydros, the Fortises, whatever, there's no company that, that you couldn't reach out to and offer an executive package, where they come in because they are typically there because they are in extremely stressful work environments.
Mm-hmm.
And it's not just something where they get it because they're in a more elite position,
Yeah.
if you want to call it. They are in positions where this kind of programming is necessary to keep that person working and effective.
Mm-hmm.
And there's just so much potential.
There's
That you
so much
yeah,
potential, yeah. And you
yeah,
reminded me too that Tony Robbins, they called us to have us provide the food to their platinum partners. And so they were bringing, hundreds of people into Whistler. They wanted us to provide the food, but they couldn't sever their contract with the Fairmont because the Fairmont said if you provide outside food, then they're not going to let them host their event at the Fairmont.
yeah, yeah.
So they had us drive down to Vancouver and greet all of their participants off the planes and give them the food in like lunch bags so that they had access to our food, but they weren't, going to void their contract with the Fairmont. And so then after that, they called us back and said, "Can we host more events with you?" But we didn't have a space or a hotel. And so this was, so this is huge. Like, what you're saying is true. Like, we just have to reach out to a company to tell them what they're doing. And we've done it before. Like, we were, selling out our corporate wellness programs, when COVID hit and shut everything down and we couldn't travel anymore. So I'm so excited to be able to launch that again and then just bring people to a place where you can provide them their sleeping accommodation and our education and our food all in one place because that's what we've been doing for 20 years. But it's been done all fragmented, with restaurants here and wellness center there. And so now it's all under one roof, which I'm really excited about.
I imagine it would involve probably a lot of the employment opportunities is potentially through marketing and sales as well. Like you're trying to reach out to such a large group of people. Well, everybody really.
Yeah,
And
60% of North Americans.
now, Ty, a question for you, regarding that aspect of it. What do you see in these buildings that you generally need for a requirement for offices? Like if you had your marketing and sales component, I imagine that's a concern for fitting that into the building as well.
You'd definitely be fitting it in, and I think there's a really interesting overlay in the sense of creating the office space and the support areas for the people that are working there that is healthful also or health causing. Because in a lot of these instances, in fact, they're not a variety. I was just talking with somebody yesterday who was involved in one of the very global high-end wellness places that you would all know the name, and the spaces that the staff work in. I mean, they didn't see daylight for the entire day. And
Yeah,
so it's like the whole consistency of what you're doing and how you're treating each other as people, not just the hospitality side or the people that are coming to visit, but the
sure.
consistency of health from top to bottom.
Mm, yeah. And then Nicolette, if you don't mind me drawing Kyle into it, and Ty as well, if you can fill in this in, because as to designing the building, a big component and challenge is the parking requirements. How do you see that, Kyle, being exposed here to the presentation and the scale of things? What are we looking at for parking potential that we are going to need for this?
Yeah, great question. I didn't want to dampen anyone's mood, so I didn't really talk about parking very much. But yeah, I think that's something that's going to come out through the design process. And I mean, you can fit what you can fit on the property, and like other municipalities, parking is always something that comes into the discussion, and the site's pretty close to the downtown where we do have some public parking lots, but they do get filled up. So I think we just need to have, like I heard that there was a reference to 230 plus jobs generated through the hotel and the center. I mean, like how many people would be working in the building? Would they be driving? Would there be shuttles to and from airports so that you could reduce your parking needs on site? I think those are some of the questions and potential solutions I would have. But yeah, it really depends on what it looks like. In general terms, you need one parking space per hotel unit, and if you wanted to do less than that, then you need to make a rationale and address how you're going to reduce the on-site parking requirements. But again, we could, over the next 9 months, as you develop the design, we're happy to have those conversations. And
Amazing.
I don't want that to be, it's definitely an important consideration. I don't want that to be a barrier necessarily. It's just something that we have to work through.
Yeah.
Okay.
Yeah, and we're lucky to have the airport
And
just 40 minutes away as well, which is great. And so, luckily as well, the mayor of Whistler owns a massive transportation company and has a whole platform for that. So we're engaging him to better understand how we can have shuttle services operate with the hotel and work with his company because he's got the full tech platform for that, and to be able to do that. And then, of course, with having airports in Victoria and Nanaimo, and then having the ferries there as well, like working on transportation is going to be a huge component of what we do. As far as employees, we would love it if we can train local employees who are already living here, and within, it would be incredible to have them within walking distance, biking distance would be our dream, and which is why we're really working to train 1,000 individuals locally, because we'll need some of those individuals to be able to work remotely as well, because they'll train the guests that come through the hotel ongoing after they leave. And so it'll be 230 jobs directly in the hotel, but additional jobs that are done remotely as well. So yeah, so this is going to be a significant part of what we're doing, because we obviously don't want, there's already a lot of congestion in downtown Duncan as well. I shouldn't say congestion, but a lot of the parking spots are full. And so we want to mitigate that as much as we can.
it's a very good question, Greg, because I think often, we think that it's type of a building and this many people are visitors, but the profile as well as the mission and the values of the organization, it would seem would drive something very, very different and get into the real data of it.
And
Yeah.
even though, well, I
Sorry,
was
go
going
ahead.
to say, even though a lot of my clients came from the US and across Canada, and they weren't always from within the community, one of the things that I know is going to happen is over the years is that as more and more people on the island learn about the hotel and wellness center, that we're going to have a lot more locals will make up a good portion of the guests that we have coming for the additional wellness services, and then staying at the hotel. So we're going to have that inter-island commute happening, as well as people flying in who may or may not have to rent cars and need a parking spot. So yeah, it's going to be, we'll work with you closely to make sure that we yeah, plan for that, both Ty and Kyle.
Yeah, I know Ty regarding the parking. I mean more of just in a condo rental building. Sometimes they resolve the problem by adding an additional level of parking on the ground floor. But going back and forth with Kyle, there, we're trying to activate. I guess is the word that I've seen used by architects, the ground floor. So when you're walking at ground level past the building, you're not looking at a level that's parking. So when it is more the lobby design, the restaurant, if it's right there in your face, you can
Absolutely.
see the activity, and it really livens up and
Hmm.
energizes the building. I'm not sure if you can add to that, but again, just reaching out. I know we can go as deep as 2 levels there with underground parking, but it would probably you can add more to it if you were to do parking on the ground level. It'd probably take away from it.
I think you're right, and certainly going down is real money. And it's, I think, just being really strategic on what the options are, what the choices are, and what the real numbers are.
Yeah.
I mean, in fact, I think if you look at the cost of below grade parking compared to the costs of shuttles or other things, the other alternatives would become very attractive. And it's interesting with different companies on what they do, certainly the ones in the education sector for us, on what they do as benefits to encourage other uses or other alternatives as opposed to the parking spot or undergrade parking. But I think it's clearly tied into the values of the organization.
Yeah, Kyle, what do you think of that? I mean that's pretty difficult to run a business when the parking space is providing for one person, as opposed to shuttles where you've got multiple people coming in. Yeah, Ty, that's a good point. I mean, that's
Yeah, I think
money.
it's a study we'll need to get into.
Hmm.
Yeah, I mean, I like again, this is getting into the details, but um, any sort of parking variances to the bylaw require council approval, and parking is a sensitive, issue in Duncan. Like some other municipalities, we're still very the people who live locally are still so very vehicle oriented. It's not like Victoria or Vancouver or Toronto, and so people still generally own a car. So I mean I think I can say pretty definitively you're going to have to do those 2 stories of underground parking like you had planned, Greg, in your previous
Yeah,
development.
yeah,
I would agree. I would hate. I don't. In fact, I wouldn't support any sort of ground level parking taking away from those ground level uses. I think that would be a bad idea. So below grade parking, you can fit what you can fit, and then you just have to make a really strong rationale for all those other mitigation measures and um, yeah, that's
I think we get a traffic engineer and really dive into the real patterns and the usage.
Yeah.
yeah we.
So you open and it works, which is the main idea.
Yeah,
Yeah.
yeah, yeah.
So just given time, everybody, I would like to bring this meeting to a close. I love all these. I love how we're diving into the details now, which is really exciting. I love all the feedback that we've gotten in the comments, and thank you for the individuals that have reached out privately and also in the group chat here. We will be reaching out to you. And like I said, if there is anybody out there who wants more information after this meeting, please reach out to us directly. We're happy to sit with you and answer any and all questions. And of course, if you can think of anybody that we need to reach out to let them know about this project, who could potentially be a partner or investor or lender, that would be phenomenal as well, because we want to see this project come to light, because we know that the community is going to benefit hugely from this, not just in Duncan and the greater Cowichan Valley, but Vancouver Island and Canada and beyond. And so I want to thank you all for taking the time to be here today. I want to wish you well for the rest of your day and rest of your week. And thank you to everybody who asked those really beautiful questions as well, just so we can dive deeper into this. So I'm going to sign off now and let everybody get back to their day. But thank you again, and I'll leave it at that.
And a
Thank
hearty
you.
congratulations.
Thank you, Ty. Thank you. Really excited to be working with you. Again, thank you to Kyle for being here. Really wonderful to have your input and support. Greg as well. Thank you for everything, the land. Scott, thank you for joining our team. And thank you to everybody else who's on this call. Scott, Leah, or Greg and Leah as well. Greg's partner is on the call as well. Okay, bye everybody. We'll send out the recording and we'll be in touch again soon with more information as the project progresses.
Thanks so much, Nicolette. Great
Okay.
presentation.
Thank you. Thank you. Okay, bye everyone.
Thank you.
Thank you.